Hello everyone, we will be discussing about maternal pelvis today. Maternal pelvis is divided into false pelvis and true pelvis. There are two joints in the maternal pelvis. First is the pubic symphysis joint, which is secondary fibrocartilaginous joint. Second is the sacroiliac joint, which is a synovial joint. Let's discuss the false pelvis. False pelvis lies above the true pelvis between the iliac fossa. So, if we keep a piece of paper here, what contributes above this paper is false pelvis. Now let's discuss about the true pelvis. True pelvis is divided into inlet, cavity and outlet. In the inlet there are three anterior posterior diameter. First anterior posterior diameter is the anatomical diameter which extends from the sacropromontory to the upper border of pubic symphysis. This is also known as anatomical conjugate and it is 11 cm. Second diameter, it extends from the sacral promontory to the midpoint of pubic symphysis here. This is known as obstetric conjugate, which is around 10.5 cm. The third diameter is the diagonal conjugate, which extends from the sacral promontory to the lower border of the pubic symphysis. This is around 12.5 cm. As you may have noticed that the sacral promontory in the three diameters is a common point. The diagonal conjugate is the only diameter which can be measured clinically. Then we come to the oblique diameters. The oblique diameters extend from the sacroiliac joint to the iliopubic eminence. Here, if we have taken the right sacroiliac joint, then it will be the right oblique diameter, and if the point is the left iliac joint, then it will be the left oblique diameter. This is taken to be around 12 centimeters. Finally, we come to the transverse diameter. Transverse diameter is the farthest point on the pelvic brim on the iliopectineal line, that is around 13 centimeters from here to here. We can easily remember it as 11 centimeters, 12 centimeters, that is the oblique diameter, and the transverse diameter 13, 11, 12 and 13. The pelvic inlet has boundaries which can be easily remembered as 9 points. Firstly, the 4 P's: upper border of pubic symphysis, pubic crest, pubic tubercle, pectineal line. Then we have the iliopubic eminence, which is this area, the iliopectineal line, sacroiliac joint, ella of sacrum and sacral promontory. Is between the pelvic inlet and the plane of least pelvic dimension. It houses the plane of greatest pelvic diameter. All the diameter in the pelvic cavity is the same, that is the anterior posterior diameter, oblique diameter and transverse diameter, that is 12 centimeters, which is very easy to remember. The plane of great pelvic dimension is between the midpoint of pubic symphysis to the junction of S2 and S3, which is being marked here. Plane of least pelvic diameter is between the lower border of the pubic symphysis to the S4 and S5. The least pelvic diameter basically describes the plane of ischial spine. The interischial spine diameter here. The interischial spine diameter is taken to be 10.5 centimeters. Let's discuss the importance of ischial spine. First, ischial spine, it is the place of origin of levator ani. Second importance is that it is where rotation and engagement occurs. Third is that it is a place of zero pelvic station. Fourth, that it is a point where you give pudendal nerve block. Fifth, that it is a point where curve of Caris becomes forward. Curve of Caris is basically the direction of birth canal. Initially it is backwards and downwards. From this point, that is the ischial spine, it becomes forwards. Let's come to the pelvic outlet now. The boundaries of pelvic outlet includes pubic symphysis, ischiopubic rami, ischial tuberosity, sacroiliac ligament, and finally the sacrum. Keep in mind that it is the sacrum, not the coccyx. Here is the intertuberous diameter, which should be around 11 centimeters. Let's discuss some clinically relevant point regarding maternal pelvis. Clinically, we measure the diagonal conjugate and the intertuberous diameter, which we measure by putting the 4 knuckles. If the 4 knuckles can fit easily into the intertuberous diameter, it means that the outlet is having enough space and it should be around 11 centimeters as we have already discussed. Last thing to be discussed is the subpubic angle. Subpubic angle should be around 90 degree. If it is reduced, it means that the intertuberous diameter is lesser and the baby will have difficulty coming out. Thank you.